We're here to talk about what is a significant problem in America, and that's how to provide health care in a way that is good for the patient and good for the doctor. And I'm really glad that the Association of American Physicians and Surgeons has invested so much in this issue, and joined here by the Minnesota Physician Patient Alliance under the leadership of Dr. Lee Beecher, who is going to be one of your speakers today. I put up a couple of slides today just to help me guide you into this presentation. You all are familiar with this friendly-looking face. The former Speaker of the House, Nancy Pelosi, who would very, very much like to be Speaker of the House again. And, of course, that's going to be determined this fall. Well, and you all know about her favorite quote, that we have to pass the bill to find out what's in it. Well, leave it to a doctor to come up with the response to this. The doctor said, that's the definition of a stool sample. Have to pass it to find out what's in it. We've been finding out ever since. So many things that have surprised us, shocked us, concerned us, worried us, and yet looking always for the antidote. One of those antidotes is the reason you're here today. Many of you read the article just in the Wall Street Journal just a few days ago by a doctor, I believe, out of New York. In my 23 years as a practicing physician, I've learned that the only thing that matters is the doctor-patient relationship. And you'll hear the reformers, the Affordable Care Act reformers, saying that they believe in that principle. But instead of doing what will strengthen the doctor-patient relationship, they insinuate more and more regulation, more and more boards, more and more cost, more and more recertifications. The list gets longer and longer in that relationship. We're here to try to resolve that today. So this doctor asked, so when do we say, damn the mandates and requirements from bureaucrats? When do we stand up and say we are not going to take it anymore? The great quote from the old movie Network. When are we going to say we're not going to take it anymore? And I'm hoping that today is part of that transition in the lives of some of you at least. If patients knew how we get paid, a doctor wrote, and I think a little bit naively, by the way, if patients knew how we get paid, they would rally to defend their doctors and not vote for corrupt politicians who brainwash the public into thinking we are overpaid and thus deserving of cuts. Well, perhaps if doctors spent or had the time to spend with patients explaining all this and interacting with them on a more personal and intimate basis, the patients would understand this. And again, that is part of what we're talking about. Another doctor on the same day wrote, the insurance industry and federal government have learned that once you've gone through college, medical school, a fellowship, and you have a family, mortgage, and education loans to support, you'll comply with any regulation, work any shift, and accept any compensation, because what else can you do? Boy, that sounds like a life of servitude to me, not a life of service. One thing that really struck me when we did this in August, as the doctors shared their stories, was the sheer joy that they had in their practices, not the drudgery of this statement. Another thing that crossed my mind was I was asked to speak to the Benjamin Rush Society at Mayo Clinic several months ago, and I asked one of the senior doctors here actually in this room, what should I talk about to these young students? And his response was, tell them how they're going to get paid. See if we can get their attention. And you know what? I discovered they didn't want to talk about that. They wanted to talk about all the great things they were going to do in their life because they were doctors. And yet here, what a critical issue that these young students need to get their arms around. How are they going to get paid? This is what I'm about. Dave Racer, the writer. I've written 8 books on healthcare reform, spoken all across the country on this issue, and I really, really strongly endorse this concept of bringing the doctor and patient back together in a relationship that's intimate. It's the best model for patients. It's one that fully engages them with their doctor. The patient knows the cost and why it's important to receive the medical care. Now at this point I have to embarrass someone in the room, and don't be afraid by this picture as it pops up pretty soon. His body is going to pop up here, and I'm really glad that Dr. Gehrig is in the room today. Did it again. I get emotional. Now, he said I'm supposed to keep it light, but it's really hard to keep it light when several months ago, actually Christmas Eve 2012, I woke up and had an incident in my head and called this man on his cell phone and said, this is going on. And he said, David, I think you're having a brain bleed. Is your wife there? And I said, yes, she is. And he said, you have her take you to an emergency room right now. And I did. I had a brain bleed, a subarachnoid hemorrhage, spent 11 days in ICU, and another 4 days dealing with other issues there before I was let out. And I had the pleasure of looking at Dr. Gehrig and saying, you saved my life. Well, at least you saved my quality of life. In fact, I've come to the conclusion, doctor, that having that brain bleed and all that treatment afterward washed out a lot of impurities, and my mind works better than ever. So I am a testifier to the value of having that doctor-patient relationship. I am on Medicare, but I don't care. When I have a medical need, I call that guy right there. And he's always been able to respond, even when he hasn't been here. When he's been somewhere else, he's found a way to do that. I did make him bill me for an email the other day, though. We're moving on in this relationship, so it's a great one.